My name is Dr. Maddison Campbell. I'm a clinical psychologist and trained in neuropsychology in Australia before moving to Edinburgh. CBT or cognitive behavioural therapy is an evidence-based intervention that tries to understand how people are feeling based on how thoughts, feelings and physical sensations and behaviour are all connected. So cognitive behavioural therapy is useful for treating a range of mental health conditions. There's really good evidence for CBT in treating things like anxiety, depression. So often when there are negative thought patterns that are impacting mood, we see things like rumination and negative thinking, meaning that people feel more down or low in mood. Thinking patterns like catastrophizing, lots of what-ifs, can be associated with anxiety and panic disorder and can really help with things like low mood, stress, burnout, or substance use disorders and things like trauma too. The process of CBT is often that a person will come for their initial sessions. So for the first usually 2 to 3 sessions, we're really getting to know what's currently happening for a person. Often you might be given some homework to monitor things, to keep track of things week to week. And then we have a look at those examples. We look for patterns in thinking and behaviour. And then we start to give you some things to test out or try to challenge some of those expectations or thoughts. It will look different for different people. Often for different conditions there are particular types of thinking patterns or behaviours that can keep that particular problem going. Once a person then spends some time kind of monitoring and keeping a track of those things, they can start to see the patterns themselves. At the Edinburgh practice, there's a range of psychologists that can provide CBT. Coming to therapy can be a challenging thing to do. It can be the first time someone has come to therapy, or if they have come before, it's coming to a new place where the Edinburgh practice is located. Yes. I find that often people are then having to make public transport journeys into the practice, or sort of have the opportunity to challenge maybe some of their worries or put themselves in a busy place, on the Royal Mile in Edinburgh, to come and see us. But then, while they're doing that, they're also coming into a practice that's very calming and can feel quite safe. So a good place to sort of work on these things before they then step out again into the busyness of Edinburgh.